Anytime you experience issues with your vision, you should get it checked out. So let's welcome Dr. Mansoor Mughal, a neuro-ophthalmologist and retina specialist with Retina Associates PA. And Doctor, good to see you again, first of all.
Thank you. It's great to be here.
Yeah, so you've got new locations around town, and that's made a big difference. And I hear the patients are having a good experience with you.
Absolutely, we're grateful to help all the patients at our new locations. We're getting busier and busier, and that's great.
Yes, it is. Okay, so neuro-ophthalmology, and that's a big word, but what you do simplifies things and helps people. So tell us some of the common conditions folks have with that issue.
Absolutely. So neuro-ophthalmology is basically, it's a pretty niche specialty, and it focuses on the interface between the brain and the eye. And many conditions that affect the eye also are generalized conditions that affect the nervous system as well. So the most common kind of conditions that we see and that I see in my practice are patients who have suddenly lost their vision, young patients, and they may have optic neuritis or the beginnings of multiple sclerosis. Obviously, they're worried about that. Other conditions that I see are people with a condition called idiopathic intracranial hypertension, where they have headaches, loss of vision, and then we get to investigate the reason why they have all of these symptoms. Okay, and you're one of the leaders around town with this type of technology you have. You just have some technology that can help folks out in a big way. Absolutely. I mean, but any patient who presents with these kind of symptoms, we start off very simply. We measure their vision, we look at their pupils, we look at their eye movements, we look at the eye itself structurally to see whether it's normal. We also have ancillary tests which we can do with testing side vision. It's called a Humphrey Visual Field Machine, so we can check if there's any deficit there. And then ultimately we may even send patients for an MRI scan, if we're concerned enough to check the optic nerve behind what we can see, and obviously the brain itself. Right, so I think the biggest things patients want, you want to earn their trust, and that experience is important. Can you elaborate on that? Absolutely. I think whenever anybody has a scary kind of diagnosis, or whether whether they've been told by their providers that their optic discs are swollen, or they themselves can't see, or they've suddenly lost their vision, it's extremely scary for the patient. But not just for the patient, also the provider as well, as to figure out what's going on. There are a couple of conditions that can happen that are life-threatening, and it's our job really to pick through the pieces of the symptoms, and to also then diagnose what we can, and then use those new technology and modalities such as MRI to actually see exactly what's going on, to reassure the patient or to refer on, if needed, to neurosurgeons, to endocrinologists, to various other colleagues. Right, so a lot of times my eyes get dried out, and even how do you know you have a serious problem? What are some of the symptoms folks should be concerned about, or when they should come see you? I think, if you have symptoms such as double vision, sudden loss of vision, vision that's gradually been deteriorating with no discernible cause, and these are conditions that definitely interest us as neuro-ophthalmologists. Okay. And we're happy to see patients, from other providers and our optometry, ophthalmology colleagues, and in fact within the greater medical community as well. And you have, once you get those symptoms, you have plenty of treatments. What type of treatments would you have? I think it's very much focused on what we diagnose. So with neuro-ophthalmology, we start off with some symptoms that may be quite vague, but we try and pin down the diagnosis with a great degree of accuracy. So once we can find out what it is, we can then go ahead and treat it. So for example, if it is multiple sclerosis or optic neuritis, that benefits from treatment with steroids, which can improve the visual recovery time. But it entirely depends on what we find. Right. And we tailor the treatment to that. Very good. So helping Jacksonville see better, not just a motto. And how can folks find you? So we're on our website, and also they can call our office anytime, and most providers will have details of how to refer to us. All right. Thank you so much, Dr. Mughal. And of course, you can go to our website for much more on this. That's firstcoastliving.net.